Now, a lot of patients will ask me about, these new novel therapies and about pricing and the cost of therapy. But in reality, we could see over time the cost coming down or being much more affordable. And access to care, affordability seems to be on the minds of patients all the time.
Right, and it should be.
Yeah.
That's one of the concerns of oncologists, that we have these very good drugs, and we want every patient to have access to these drugs. And we're very hopeful over time that we will be able to get pricing in such a way that everyone has access to effective therapies.
Now, I was talking to one of your colleagues earlier, and I was mentioning that patients will call me, email me about clinical trials, and they're concerned that the quality of care may not be the best when I enroll in a clinical trial. And those kind of myths really need to be dispelled. How do you talk to patients about those concerns?
Well, that's a good question, and there are concerns and a lot of myths out there about clinical trials. One of the things that we know is that outcomes for patients tend to be better on clinical trials. You have a lot of oversight when you're on a clinical trial. There's a lot of explaining that you have to do when there are side effects that occur. One of the things that I like to tell patients about clinical trials is that really every treatment that we have now is because someone was on a clinical trial before. And we know, because of the people that were treated before you, some of the treatments that are our standards of care are because of the people who came before and were willing to participate. Clinical trials are necessary to advance cancer care. And one of the things that we want to make sure is that people know that we are not giving people substandard care on clinical trials. We don't put people on clinical trials unless we feel comfortable. There are some clinical trials that we refuse to put forward because we didn't feel comfortable with it. And so we want to make sure that we are giving our patients the very best opportunities to improve their care.
Well, doctor, thank you so much for stopping by, and best of luck.